AstraZeneca for all sorts of reasons, and many Canadians are deeply concerned that the risks no longer, or the rewards no longer outweigh the risks given the blood clot. What's your reaction to that?
Yeah. So look, I don't want to I don't want to comment on the decisions that Canadians and Canadian provinces take. I think it's really up to them to decide what vaccines they're going to want to use and how. But I think it's probably worth remembering that there's still lots of things we don't know about this pandemic. There's still lots of things we don't know about both vaccines. There are lots of things we don't really understand about the clotting issues associated with the AstraZeneca vaccines. And there are things like the signal of myocarditis from the Pfizer vaccine, which, as you know, was found in 60 people under the age of 30 in Israel with 2 deaths. So we're in a situation where we're learning as we go along, and there are very few absolutes about what's going to happen and what isn't going to happen. And I think the argument for continuing to use the AstraZeneca vaccine, certainly in populations of people over the age of 40 or 50, is that the incidence of these rare events, they are very, very rare. The Indian strain has now arrived in the UK. It will arrive in Canada if it hasn't already, probably already has. And at my last look, you guys are 3.6% vaccinated with 2 doses. So just wait for that one to rip through the Canadian population. And then the problems you've had with these very rare clotting events will look pretty insignificant next to that.
Okay, so John, this is interesting because there's a lot of talk about Canadians who say, I don't want my second dose of this now. I'm going to wait. There's a study in the UK, and we keep hearing from public health officials that there's positive signals about mixing and matching. So if you're worried about AstraZeneca, don't worry about it. Your next shot, we're going to be flooded with Pfizer and Moderna. You can mix and match and take your second shot of Pfizer and Moderna. So we may not need all the 20 million AstraZeneca doses that we've ordered. What's your response to that?
Well, I think that reflects the whole Canadian approach to vaccines generally, and that is acting on a lot of hearsay, not facts. So we're doing the heterologous boosting experiment here in Oxford, 800 people in an arm, Pfizer, AstraZeneca, Pfizer, AstraZeneca, Pfizer. And our experience to date is that it produces pretty severe reactogenicity, so severe that we don't think that's going to be viable. And by that I mean, you get your second dose, if you flip it over, you'll get really sick. So I would not advise that. And the second dose of AstraZeneca, which we've now put in to many, many millions of people who had a first dose of AstraZeneca, we're not sure we can even find a single case of clotting problems. So, bad idea. This needs to be data-driven.
Okay, sorry. This is really interesting because a lot of people are investing a lot of hope in this, that soon that our health officials are going to say, mixing and matching is possible. And we've also heard it may even be better. 1 shot of AstraZeneca, 1 shot of Pfizer. You're doing the testing. I just want people to understand, you're saying as someone who's looking at that, it would be, if you're one of the 2 million Canadians who got AstraZeneca, you're saying take the second dose?
Much better to take the second dose. Much better to take the second dose. The only reason to think about heterologous boosting, and to be clear, we don't have all the immunogenicity, all the antibody data from those studies because they're big. We're doing them in 800 people each, so it takes a while to get them done. But at the moment, I don't think we would be jumping up and down enthusiastically because the reactogenicity, the effect you have with the second dose, either way you flip it, is pretty severe. And not only that, but you shouldn't, with a second dose of AstraZeneca, you shouldn't need a Pfizer dose. Your antigen reactivity levels will be super high. You'll be fine against all the standard variants. And if you have a third dose of AstraZeneca, your antibody levels go even higher, much higher than they do with Pfizer. So, and you don't get any clotting problems that we see after you've had the first dose. So, come on, guys. But either do the experiments yourself or listen to people who do them.
Dr. Bell, I can see the frustration here because a lot of people now, we are going to get a lot of Pfizer, but we still have ordered a lot of AstraZeneca. A lot of people are saying when they want a first dose, I don't even want to take the risk of AstraZeneca. I'll wait and get my first dose of Pfizer. In other words, we in Canada, they're literally called the preferred vaccines. Our science officials say the mRNAs are the, quote, preferred vaccines over the viral vectors. Your response to what kind of messaging that sends at a critical time?
Yeah, so, look, if you've got stacks of Pfizer vaccine and stacks of Moderna vaccine and you want to take those vaccines, those are very good vaccines. I'm not disputing that at all. If, however, you've got supply chain issues, which I suspect you do, the most important thing at this moment in time is to get everybody a first dose of vaccine. That's what we did in the UK. We really pushed the boat out. We're now 60% of people have had a single dose, probably more now. And actually, we've had no deaths now for many days. There's no hospital admissions. And indeed, even though we've got Indian cases, we're not having too much trouble. So you guys are sitting at 3.6% of the population with one dose. Yeah, unless you've got
with two doses
of mRNA vaccine sitting in the back room, you need to get on and vaccinate people with any one of the four good vaccines: Johnson & Johnson, AstraZeneca, Moderna, or Pfizer. And all this messing around is going to cost lives. It's a public health decision. It's not some academic game. It's a public health decision. Let the public health doctors make a decision.
Just for the record, Canada has about 50% of its adult population, 18 and up, one dose. But you're right, less than 4% of Canadians have got the two dose. Just final thing. So if Canada has now our top health official on Friday was speculating, look, if we don't need all these extra AstraZeneca that we've ordered, we may not even want them. Just again, I know there's an Indian variant that has arrived in Canada. We know that. Are you saying it would be prudent to whatever vaccine you can get, still get as many people, Pfizer, Moderna, AstraZeneca, Johnson, just go as fast as possible? Would that be your suggestion?
Yeah, look, this is a sort of race against time. And the Indian variants, the two known Indian variants that are causing so much trouble in India, are much more infectious than the Kent variant. And they transmit much faster. So once it takes hold, it's going to move really quickly. So there's no time to waste getting people a second dose. And what we can see is that the more people with a second dose, the more people will have antibody levels that are high enough to deal with the Indian variant, which is where we are at the moment in the UK. So my advice is get people two doses as fast as you can and hunker down. So for the Canadians to be out thinking about whether they should have a second dose, eating marshmallows around the campfire, looks a bit silly to me, frankly. And look, if you guys have got 70 million doses of Pfizer sitting around and you can whack them into people quickly, good luck to you. I have no problem with that at all. I just think this game of waiting around for the perfect solution while there's a massive pandemic coming in your direction, that does not look smart to me.
Sir John Bell, it's always a pleasure to have you on the program. Thank you, sir.
Nice to talk. See you soon.
Joining me now is Health Canada's Chief Medical Advisor, Dr. Supriya Sharma. Dr. Sharma, first of all, thanks for your work and always joining us on the program. This week, many provinces, and we just heard me say like Ontario, say we're stopping issuing the first shots of AstraZeneca because of the safety signal, the concerns. But the Indian variant has now arrived in Canada in some places. Is it prudent for provinces to essentially bench a vaccine that has pulled the UK fundamentally out of the pandemic? Doesn't speed for any vaccine matter?
So, with respect to AstraZeneca, it's a good vaccine. It's still a good vaccine. Health Canada has authorized it. The benefits overall outweigh the risks. There is this serious, rare but real risk of clots, and we've talked about that before. So what we're facing right now is a time that we expected to come. We have limited supply of AstraZeneca coming in. We have a huge supply of the mRNA vaccines coming in. We've reached a marker where we've got about 50% 50% of the adults that are vaccinated. So we were always going to have this pivot point about how we were going to use the vaccines that are coming when we have, potentially looking forward more supply than demand. So what provinces are looking at right now, they're looking at the supply that they have, the numbers of first doses that have been given, the plans that they need to reserve vaccine for second doses, and then overall what's happening with COVID-19 in their provinces. And then they're making their decision, as they have been all along, about how best to use the vaccines that are supplied to them.
But it's fair to say confidence in the vaccine is clearly plummeting. There's a lot of confusion, and people are worried about it. We just spoke to Sir John Bell, who oversaw the development of the Oxford AstraZeneca vaccine. He says Canada is actually overstating the risk versus the rewards, especially at this time. But he did point out that there are risks for the mRNA vaccines like Pfizer as well. He actually cited some deaths in Israel from heart issues associated with the vaccine. From the Canadian health perspective, are there risks associated with Pfizer? And if so, what are they?
There are risks and benefits of any treatment in any vaccine. If there are no risks associated and if there are no side effects, it's probably not doing something. So absolutely, we're always balancing those things. What are you getting from the vaccine? In this case, it's prevention of a disease that's potentially fatal versus what those risks are. And even with Pfizer and with mRNA vaccines, there are risks that are associated with it. Specifically, when we're looking at that issue around, we call it myocarditis or heart inflammation, all of the regulators internationally are looking at it, including Israel. And so far, the numbers that we've seen are not higher than what we would expect to see in a population that did not get the vaccine.
Dr. Sharma, on Friday, Dr. Theresa Tam said people who took the AstraZeneca, the 2 million folks who did it, may be able to wait and get a Pfizer or Moderna, the mRNA vaccines, for their second shot, the so-called mixing and matching. And she said, the early studies look good. But again, Sir John Bell, who works at Oxford, where the mix and match study is taking place, told us the data doesn't look good, and it doesn't support a mix and match. I just want to play you the clip of what he just told us. Here's what he said.
Our experience to date is that it produces pretty severe reactogenicity, so severe that we don't think that's going to be viable. And by that, I mean, you get your second dose, if you flip it over, you'll get really sick. So I would not advise that.
You'll get really sick. I would not advise mix and match. That's what he's saying in the early part of the study that he's seeing. Now, we haven't seen a lot of that. That's the first time I've heard that. What do you make of that, and what does Health Canada make of that?
What I make of it is what I've made of any research that's coming out on COVID-19. I think what happens is that studies are ongoing. A bit of information is released publicly. Everyone's got a hot take on it. We've seen that just with some studies on Pfizer that have come out before people have had a chance to see the evidence. So what I would say with respect to AstraZeneca and the people that have received it, first of all, thank you. Thank you for protecting yourselves, your families, your communities, and helping to, sustain a health system that was really, really, really stretched and still is. So thank you for people that got AstraZeneca. And then the second part of it is, with respect to a second dose of AstraZeneca, when we look at the studies, the optimal dosing interval between the first and second dose is actually a bit longer. It is 12 weeks in the trials, and that gave you better immunity. So what I would say is, look, you've got your first dose. You can wait until 12 weeks for your second dose. When we have that time for that second dose, we will have the actual data from that study that's coming out of the UK, not just on the initial part that talks about reactogenicity or those side effects. We'll have information more on the safety side, more on how effective that is. We can take that information and then compare it to the information for AstraZeneca for second dose, and then we can offer people an educated, informed, empowered choice about their second dose.
Right. Although he's Sir John Bell, he's the guy that's overseeing that, so I don't know if it's a hot take, but it was certainly a negative take. But as you say, he's advising people who got the AstraZeneca, though, he says, take the second shot if you can, and he said the reason is they've had zero evidence of blood clots with the second dose of AstraZeneca. Is that what Health Canada says too?
So the best information that we have around the incidence of these rare blood clots with second dose is coming out of the UK, because in Canada we've only had just over 4,000 doses of AstraZeneca given as the second dose, so just a very small number. In the UK, the rate of VIT, from what we've seen, is about 1 in 1 million. So again, those cases are still being looked at, they're still being confirmed, but if there is a risk of VIT, it's certainly much lower. We don't think it's zero. but we think that it is much lower.
I just want to pick up on this intervals, and I want to focus specifically on Pfizer and Moderna, the mRNA, because there was a lot of concern, people saying you've gone off-label Health Canada. You've not waited the 21 and 28 days. There was worried about how effective they would be if you wait 2, 3, maybe even 4 months. 50% of the adult population has a vaccine, many of them Pfizer and Moderna. Do you have new data on how effective these vaccines are if you wait this 2 to 4 month interval period on those vaccines?
Right. So from a Health Canada perspective, the authorized vaccines for Pfizer and Moderna have not changed. The interval has not changed. So the Health Canada position from a regulatory side of things is really 21 days for Pfizer, 28 days for Moderna. The interval in terms of extension really came out of recommendations from NACI, and the goal was really public health. Get as many first doses